Hello everybody, my name is Dr. Eric Miller. I'm with Chiro-Med Health and Wellness Centers in Orland Park, Illinois. Today's topic is about sciatica. Sciatica is a condition in which the patient presents with generally lower back pain and pain in the leg. Typically, the pain in the leg is produced by an actual pinch of the sciatic nerve. The sciatic nerve is the largest nerve in the entire body. It's made up of a few different levels coming from the spinal cord. Let me show you real quick. When we look at this particular diagram, you're going to see that the sciatic nerve is the largest nerve in the entire body. It basically is made up from the L4 vertebrae, L5, S1, S2. These nerves come together to create the large nerve. The nerve basically goes down through the thigh, all the way down the calf, and supplies the foot. Sciatica is basically diagnosed when that sciatic nerve becomes inflamed or pinched. The pain can be excruciating. Patients, when they come in with sciatica, can have difficulty walking. They can have cramping at night in their legs. They can have very severe pain that causes a muscular spasm as well. I'm going to show you a model of the actual nerve. I'm going to put this guy, Sammy the Spine, here. Sammy the Skeleton, on the table. Now, sciatica is actually caused by pressure on the sciatic nerve. The pressure can come from inflammation. It can come from soft tissue irritation, from soft tissues being too tight, or hard tissue, which is bone. So typically, the doctor needs to find out exactly where that sciatic nerve pressure is coming from. When the patient presents to the office, they're generally going to complain of lower back pain. They're going to complain of pain in the rear end, and most likely pain that comes down the thigh, and it will either come to the side of their calf, which is called the L5 distribution, or the back of their calf, which is the S1 distribution. The pain can even go down all the way to the top of the foot, which is the L5 distribution, or the bottom of the foot, which is again the S1 distribution. So it's the job of the physician to find out what particular nerve is being pinched, why it's being pinched, and what can be done to remove that pinch. I'm going to use this model to show you exactly what the sciatic nerve looks like and where it can be compromised or where it can be getting pinched at. When I look at this particular model, you can see the sciatic nerve kind of peeking out right here. Here's a picture of it, or a look at it without the muscular components that go from the iliac bone to the hip itself. When we look at the right-hand side, you can see some, not all, but some of the deeper muscles through the buttocks and the hip rotators. So the sciatic nerve basically comes from the spine, it traverses by the sacrum and sacroiliac joint, and then through the buttocks before it enters into the leg or the thigh. The most common places for it to be inflamed or irritated are again with the soft tissue, which can be muscular. There's a muscle in the rear end called the piriformis muscle that when it becomes tight, it can actually press on the sciatic nerve and produce a lot of symptoms that way. Sometimes the sciatic nerve even goes through the piriformis muscle. It just kind of depends on how you're put together. So that's one of the first places we look to make sure that it's not being irritated at the muscular level, is the piriformis. We also have to look at the gluteus medius, which is one of your buttocks muscles. You've got gluteus maximus, gluteus medius, and gluteus minimus. When you have sacroiliac dysfunction, you'll have a lot of tension through gluteus medius, and sometimes that will create enough tension to produce some irritation of that sciatic nerve. You can also get the hard tissue problems, misalignment of the joints. So when there's a sacroiliac problem a little higher up, then we can have problems with inflammation coming from the sacroiliac misalignment, creating pressure on that sciatic nerve, or misalignment from the L5, S1, or the L4, L5 vertebrae, creating inflammation of the joint that ends up putting pressure on the nerve roots that come out between the vertebrae and basically supply the sciatic nerve. Another place to look for possible irritation to the sciatic nerve is the hip rotators themselves. So you've got small muscles below the piriformis muscle that can also put pressure on the bottom side of that sciatic nerve. Typically when the sciatic nerve is affected, you're going to get hamstring tension, you're going to get tension in the rear end muscles, and then you could get tension in the calf muscles as well on the affected side. So it's real important to stretch those muscles to try to calm down that muscular component of the problem. Now the way that we actually take care of the joint problem, the joints causing the inflammation, is to check out your alignment. So I'm going to show you an x-ray right here and kind of give you an idea of what a typical patient with sciatica would look like on x-ray. This is a patient that I had about 4 months ago. She came into the office and she was complaining of severe lower back pain. She was complaining of pain through the rear end, into the thigh, down to the calf, and it was localized more on the outside of the calf muscle. That represents a pinch at the L5 nerve. When we looked at her x-rays, we did a complete examination, we did x-rays, and we were looking for any type of bony impingement, either misalignment or any arthritic change or something that would be actually causing bony pressure to be placed on the nerve roots that make up the sciatic nerve. When we looked at this particular x-ray, we saw that there was a lot of spasm in the area, the vertebrae was being pulled out of alignment. The typical alignment would be that the pelvis is balanced from side to side and the spine is straight up and down along this blue line. You can see with this particular patient that she had rotation at L5, she had rotation and lateral bending at L4, and then L3 was really laterally bent to the side. There was a 12-degree misalignment, forcing all the vertebrae over to the side this way. Some of that came from just joint misalignment. Some of it came from inflammatory response and muscular spasm as a result of that. But the whole thing is basically misaligned, and that's creating that pressure on the sciatic nerve that causes those symptoms. There's only a few different ways to take care of sciatica. You know, if you go to the traditional medical doc, family practitioner, you're going to get painkillers to help mask the pain, anti-inflammatory to help to handle the inflammatory part of that, and then muscle relaxers to help relax the spasm if there's any spasm occurring. Unfortunately, that doesn't really fix the problem. When you have a mechanical source of sciatica, such as misalignment or arthritic changes, then there's really no way to get rid of that without moving the structural component. Let's take the structural example. Doc, can you zone in on these vertebrae right here? This is a typical motor unit, which is made up of the vertebrae, the disc between the vertebrae, the next vertebrae, the nerve that comes out between the vertebrae, the joint behind the vertebrae, and the space where the nerve is supposed to come out called the IVF. That's also referred to as the lateral recess. When you have sciatica that's coming from the central part of the body, it's generally going to be coming from problems with either inflammation coming from misalignment through the joint or some sort of muscular spasm around the area, or even disc material. If you have a disc pathology and the disc is bulged or especially herniated or prolapsed, then that disc material can cause an inflammatory reaction, and that can put pressure on the nerve, and that can create a component of sciatica. This particular view shows us what a disc bulge or disc herniation would look like. The jelly-filled center of the disc actually migrates towards the path of least resistance, towards the weak area of the disc, and will bulge and can actually compromise the intervertebral foramen where the nerve comes out, and that's going to create pressure on that nerve, which will manifest itself with radicular symptoms like leg pain or sciatica. There's usually a reason why that disc came about. Usually abnormal stress, if it wasn't due to a direct injury, it's usually due to abnormal stress over time that causes a weakness through the disc. Stress over time causes the disc to start to break down, and eventually that disc is going to bulge or bubble or herniate, and that's when you're going to get that inflammatory reaction that's going to create pressure directly at the nerve. So we want to try to prevent that by keeping things lined up as well as we can. And if you've already got it, realigning that area to take the stress off the disc that's already been compromised. Arthritic changes also can produce a lot of pressure on nerve roots. So if you've got a lot of arthritic change due to the disc degeneration, due to bone spur formation through the vertebrae, that bony enlargement, that bony growth, that bony spur can also produce pressure on the nerve that can manifest itself with sciatica. There are a couple other conditions that we have to rule out whenever we're trying to diagnose what the actual cause of sciatica is. Most people come in complaining of leg pain, so you've got to make sure that there's not a problem with vascularity. It could be varicosity causing leg pain, it could be a blood clot in the calf causing pain or behind the knee. You've got to make sure that you're accurately diagnosed, that you get x-rays, that you have a complete examination to make sure that you're not overlooking a more problematic situation. So we got to make sure that the venous system and the arterial system are doing what they're supposed to be doing, and there's no issues with that. And then tackle the muscular part of it, the joint part of it, and again the hard tissue part of it, making sure that the bones aren't completely degenerated and don't need surgery. The most important thing if you're having leg pain is to get a proper diagnosis. Is it really sciatica? Is it a blood clot? You need to see a physician for that. So make sure that you get to a physician that knows musculoskeletal and nerve-related conditions, like a chiropractic physician or a physiatrist or an orthopedic neurologist, somebody that deals with that regularly. The sciatica needs to be completely diagnose what's actually causing it. Is it muscular? Is it just inflammation from joint? Is it hard tissue like bone that's putting pressure on it? And can it be removed? Can we take the stress off the nerve so the nerve can function like it should and eliminate the symptoms like the burning, cramping, numbness, tingling, pain in the leg that comes along with sciatica? All right, I'm going to use my assistant Morgan, who's also my daughter, to basically run through a normal examination, keep it simple, nice and short, examination for a typical sciatica patient. So Morgan's going to represent a patient that came in complaining of lower back pain, pain that goes down through the buttocks and again goes down into the leg. One of the first things that we want to do is we want to check out the leg visually to make sure that she doesn't have any problem with swelling, bruising, heat, anything that would represent a vascular issue or a blood clot or something in the leg that might be causing the issue. So we're basically just going to pull up the leg, take a look at it, see what's going on, look at the ankle, make sure the foot and ankle are not swollen, and that's not the case, and then also check out the actual calf. You can do some pressure on the calf, this is called Homan sign, to see if there's any swelling or any heat in the calf, and if there's a blood clot there, you're probably going to see some swelling through the calf, you're going to see some swelling over the top of the foot, and it'll probably hurt when you actually squeeze the calf. After we have visually inspected the legs, make sure that everything's cool with that, then we're going to go through some real simple orthopedic examinations. So first thing I'm going to do is have Morgan stand up. I want you to face that way, Morgan, and I want you to bend at the waist to touch your toes. So we're going to check the lumbar range of motion. Go ahead and bend over, touch your toes. She's doing really great with that. The average patient with sciatica will probably have a problem with that because this is going to create traction through the nerve as she bends over and flexes that area. Come on up. Now I want you to go into full extension. This is another place where the nerve could be pinched when you extend the vertebrae over each other. Very good. I want you to rotate as far as you can rotate from one side. Fantastic. To the other side. Fantastic. Good. Now I want you to lateral bend from one side to the other side. Lateral bend to the left. Very good. To the right. Very good. Fantastic. If a patient's having problems with a nerve pinch, generally when they bend to the affected side, that can pinch the nerve even more. That's a sign that you're on the right track and you're going to have to identify what particular level is being pinched. Let me have you sit on the edge of that table for me real quick. We can check reflexes also, just to make sure that there's not a reflex change that would demonstrate severe pinching of the nerve as well. So we can check out the patellar knee reflex. And there should be a little kick with that. We can check Achilles reflex.
Because the doctor he wanted to give me the extra visits if I
Good. Now that's going to check L4 nerve. The Achilles will check the S1 nerve. If there's a problem with the pinch there, you're going to find hyporeflexia or a decreased reflex, or you can find an increased reflex. Everything was great with Morgan, so we don't have to worry about that, but that's something that you should check. Now we also check strength. So I want to make sure that the leg strength is the same from side to side and it's full strength. If you have a pinched nerve, sometimes you can create weakness in the leg. So what I'll do first is have the patient push out against me to check the thigh muscles. Push out. Good. That's great. A +5. Push out. Good. Nice and strong. Now I want you to pull in. Nice and strong. Pull in. Nice and strong. Okay, now we also want to check dorsiflexion and plantar flexion, which is a sign of L5 weakness if you can't hold it up when I'm pushing down, or S1 weakness if you can't step on the gas, so to speak. So push that up as hard as you can, and don't let me push it down. Good. Same thing here. Good. And push down. Good. And push down. Good. If there's a problem with the pinched nerve, there can be weakness in one side or the other. And then again, we have to identify what's going on with that.
All right, well, then we'll see you Monday.
Let me have you lie on your stomach.
You too,
Thank you. Bye-bye.
Again, the three components of sciatica, or the three possible problems that cause sciatica: inflammation, soft tissue irritation, or hard tissue, can be ruled out with examination. Typically, the patient's going to present with maybe some swelling in the lumbar spine, maybe some swelling over sacroiliac, maybe muscle tension in the piriformis muscle or gluteus, maybe even hamstring tension that goes along the back of the thigh, maybe even tension through the calf muscle. So when you examine, you're going to palpate and basically find out if there's any problems with motion through the segments, if there's any change in muscular tension from side to side. If this patient, or if we're going to happen to have a problem with the piriformis muscle that was causing sciatica, I'd end up finding a muscular tension right at that piriformis muscle. And when I would poke on it, the patient would generally let you know that's a hot spot, it's creating pain there, there's inflammation, there's spasm in that muscle, and it may even light up that nerve as we put pressure here, like you're shorting it out almost. Let's just pretend that we've got a sciatic nerve problem caused from the piriformis syndrome. What I want to do with that is I want to basically work on doing some muscle work with that piriformis muscle and gluteus. I may even refer to my massage therapist to have them work on that for up to an hour, but I'm also going to do some stretching for it. Let me have you roll over onto your back for me. A great stretch for piriformis is basically taking the leg up into flexion, bringing the knee across the body. Can you see that from there? And then bringing the knee towards the opposite shoulder. That's going to create stretch to the hamstring, through the piriformis, and through the glute. So butt, hip, and thigh, basically. And then have the patient push out, and then relax. Morgan needs to stretch that muscle a little bit. That's good. Okay. Let me have you roll back over onto your stomach for me. So that's a good stretch for that particular area. Of course, we do it a little bit more, but just for video sake, we're going to shorten it up for you. We're also going to address, again, the joint movement to decide if we've got any issues with misalignment or joint fixation that are causing the inflammation that's getting onto the nerve going down into the sciatic nerve. So we're going to say that we've got an issue with the L5 vertebrae, and we're going to move that today with some manipulation. Let me have you turn over on your side, this side up. Again, a simple joint manipulation is going to work really well with this. If you saw my last video, we talked about sacroiliac, and we demonstrated a lumbar adjustment, lumbosacral adjustment, sacroiliac adjustment for that. We're going to do basically the same thing. We're going to put the patient into a position to gap that joint. The doc will lean over, drop right down through that, open up that joint, cavitate the joint, basically move that joint, and that's going to help to disperse some of the inflammation get that joint moving again so that you can kind of change the way the muscle is acting around that area. How'd that feel?
Oh, good.
Good. Another thing we do with sciatica is we do a long axis traction. So we'll actually pull the leg, just like old school traction, without all the traction device, just using your body and kind of laying into it, pulling the hip, pulling the spine, trying to make more space for the nerve to come out of the spine. And of course, we're going to stretch the hamstrings as well. I'm going to go ahead and stretch this hamstring just for demonstration purposes so you can see how it's performed. So we'll put the leg up on the shoulder and we'll basically try to get that leg up to a 90-degree angle. The patient's going to feel this through the hamstring. If the patient has pain coming down the leg when you're doing a stretch like this, that's an orthopedic test called SLR, straight leg raise. So if you're bringing the leg up like this and the patient's going, oh, it's going down my leg, or I've got pain in the back, that's a positive orthopedic finding. If you bring it up a little bit more and it starts to go down the leg more, that's positive for pain production due to nerve pinch. Another thing that you can do is check by doing what's called a Braggart's maneuver, by dorsiflexing the foot a little bit. If that hurts more, again, you're going to create more traction through the nerve by doing that, indicative of sciatica. So stretching the hamstring, stretching the calves, another way to stretch the calf would be just to get it to about a 90-degree angle, pull the foot down. This is a really good stretch for the calf muscle itself. Push up and relax, and push up and relax. Good. So we've got the stretch on the calf, we've got the stretch on the hamstring, stretch on the glutes. So basically all the muscles that are along that path of that sciatic nerve, you need to check them and stretch them if they need to be stretched. That's about it. If you get the manipulation, if you get the muscle stretch, if you handle the inflammation component of it, as long as it's not, a lot of arthritic change that's going to take much longer to accomplish your goals with that just because it's degenerative, things should respond very quickly. I hope this information's really helpful for you. If you have sciatica, feel free to contact us anytime. Our phone number is 708-403-2727. Take care.